And from the west, we go to the southern part of the African continent to tell you that Zimbabweans have once more expressed their outrage and dissatisfaction towards the government for neglecting the healthcare system. This comes following the death in Manakaland of a young doctor, Mtabisi Nembawari, while waiting for an ambulance to be airlifted to Harare. Nembawari was involved in a road traffic accident when he was coming from a rural hospital when the public transport he was traveling in burst tires, resulting in a tragic accident. The young doctor suffered a severe brain injury. Meanwhile, critics of government have accused political elites of looting funds that should be allocated to the health sector. In response, some officials have brought up the subject of sanctions against the nation as the cause to inadequate infrastructure and healthcare. In his address to the United Nations General Assembly recently, South African President Cyril Ramaphosa called for the removal of sanctions as they are affecting ordinary Zimbabweans. Ramaphosa said the sanctions in Zimbabwe were impacting neighboring countries as Zimbabweans flock in search of opportunities. And now this morning, joining me to discuss more on this is an award-winning journalist, Zimbabwean journalist for that matter, Hopewell Chinono, and he joins me from Harare. Thank you so much, Hopewell, for joining us. You need to unmute your device so that I can hear you properly.
Thank you for having me.
It's nice to have you around. Now, the finance minister of Zimbabwe, that is Tuli Nkobi, in December said about $473.8 billion were said to have been allocated to the health sector. That's about 11% of $4.5 trillion that's meant to be part of the budget. Now, we see Zimbabweans coming out to show their anger or dissatisfaction towards the government's investment in the health sector. Would you say that what the government has allocated in terms of funds to that sector has not been or is not adequate enough to buff up the health sector in the country?
Well, I have to start by saying that the figures that you have said are actually in Zimbabwean dollars, so those are not US dollars. And the exchange rate at the moment between the US dollar and the Zimbabwean dollar is 1 to around 6,000. So that is a paltry amount of money. It doesn't do anything at all to try and move the needle in trying to deal with the situation that is seen Zimbabwean hospitals dilapidated. We have got 5 central hospitals in Zimbabwe. They only need 50 million US dollars to run efficiently for the whole year. But the government has failed to provide this 50 million US dollars to these hospitals. Zimbabwe is probably one of the few countries on the continent that doesn't have a single working cancer radiotherapy machine. It doesn't have a heart bypass machine, both in the public and in the private sector. A lot of doctors have been complaining over the years about the situation of our hospitals. This is not caused by sanctions, as the ZANU-PF regime often says. This is caused by the massive looting of public funds and the plan of the country's natural resources. The doctor that you mentioned that died in Manikaland, for starters, he didn't even have money for fuel to drive his own car. That tells you how bad the situation is in terms of remuneration for these doctors. He died at Mutare General Hospital at 11 p.m. on Friday. The reason of his death was that he had serious head injuries, which required a neurosurgeon and special care. At this hospital, which is a provincial hospital, there is no intensive care unit that is working. In fact, across the whole country, all the provincial hospitals in the country do not have intensive care units that are working. The biggest 2 hospitals in Zimbabwe now have only a combined of 6 beds available for intensive care unit, which means the whole capital city and the provinces that it serves can only care for 6 patients at a time in the intensive care unit. And some of the things that are required, basic things that are required, like paracetamol or maternity units, they are not expensive. To build a maternity unit in Zimbabwe is 37,000 US dollars. And the biggest hospital in the country only has 1 maternity unit. to save millions of women. And because of that, 2,500 women die every year giving birth. And this is what has caused a lot of Zimbabwean women to now go to South Africa to go and give birth in a safe environment. 75% of women that give birth at Msina Hospital in the Limpopo province, which borders with Zimbabwe, are from Zimbabwe, simply because the government has failed. This is not caused by sanctions, because a whole government cannot say that it doesn't have $37,000 to build a maternity theater. The only maternity theater working at this biggest hospital was built in 1977 by the colonial government, which is quite a tragedy.
So if you say that we should not look at the issue of sanctions on Zimbabwe, you would recall that the South African president, Cyril Ramaphosa, also made a claim at the United Nations saying that the sanctions should be lifted. And that might just be a constraint in the sense that when you have a system that does not have the required or necessary revenue to drive some critical sectors of its economy, of which health is also a particular and an important part of it. It probably might want to seek funds from institutional organizations, probably have a public-private partnership with some investors or some people who might also want to invest in the sector to optimize, and most especially now, the health sector. But then when we have restrictions like this, don't you think, if you are to look at it critically, don't you think that might just put a bit of constraints on what the Zimbabwean government might be able to provide at a particular time in terms of optimizing the infrastructural deficit in the country and providing equipment that would help deal with the health needs of the citizens?
I'm glad that you called what President Ramaphosa said a claim. It is a claim, and it is not a truthful claim. As I've explained, let us look at the maternity sector. 2,500 women are dying every year giving birth. The government says it is caused by sanctions. And then when you look at how much is needed to build a maternity theater, it's $37,000. The government of Zimbabwe has got thousands of Toyota Land Cruisers. To land a Toyota Land Cruiser, according to the government figures, it's $400,000. One Land Cruiser would build you 11 maternity theaters. So it throws away the argument that sanctions have caused this problem. If you look, as I said earlier, at the amount of money that is needed to run all the 5 central hospitals, the referral hospitals in Zimbabwe, it's only $50 million. If you look at the amount of money that the president gave his ministers as bonuses at the end of the last term, that was over $34 million. So the funds are available, but they are being misappropriated. The funds are being looted. The country produces a lot of minerals. We've got over 60 minerals in this country. If you look at gold alone, by the government's own figures, $150 million worth of gold is smuggled every month by the ZANU-PF political elites. That is enough to run all the central hospitals in this country for 3 years. So the sanctions argument is invalid. It is an excuse that is used to justify corrupt rule and to justify incompetence and to justify the failures of this particular government. I don't support sanctions. In fact, I want them to go because I believe that they've been used as an instrument to explain the failures and the corrupt rule in this country. And yet they have nothing to do with the failures that we've seen in this country. We don't have clean drinking water in this country in urban areas. That has not been caused by sanctions. If a government can afford to pay each and every judge in the High Court and the Supreme Court $400,000 as a bonus at the end of the year, an amount of money that can build you 11 maternity theaters, that government has no business using sanctions as an excuse for failing to deliver basic health deliveries.
Now, Hopewell, moving forward, now that you've identified that the issue has to do with corruption, looting and mismanagement of funds, what is the way forward? How do you think, because of course the people are agitated, they're angry as of now, how do you think the government can deal with the issue of corruption, looting of public funds, mismanagement of these funds in the country?
Well, the government simply has to stop the looting of public funds and the plunder of the natural resources that belong to everyone in this country. I went to prison 3 times, twice in 2020 and once in 2021, for exposing this kind of corruption. So it means the government is not yet ready to deal with the corruption if it's jailing journalists who are helping it to expose where the loopholes are. In a normal country, a person like myself who has exposed corruption would be rewarded. But in a country like Zimbabwe, I'm punished, I'm persecuted for exposing corruption. So it's important for the government to understand that things can only start moving if it stops the looting of public funds and the plunder of the country's natural resources. I have been revered and given awards in other countries by other presidents of other countries that have seen the work that I've been doing in exposing corruption. But in my own country, the government calls me a national state security risk.
Well, I guess there's a lot of work to be done to hold the government accountable in that regard. So Hopewell Chinono, it's nice to have engaged you on the news. Thank you.
Thank you.